Hello guys, this is Madhusudan Sapkota and I am going to describe about the wound and wound healing in this video. So let's know about wound. Wound is a disruption of any tissue, which may be soft tissue or the internal organs. Wound is defined as the breach in the normal tissue continuum resulting in the variety of the cellular and the molecular inflammations or sequelae. And wound healing means the process of the inflammation, proliferations and remodeling, and it consists of the three types: primary, secondary and tertiary, and it has three phases: proliferative phase, inflammatory phase and the remodeling phase. So let's discuss about the wound, its types, and wound healing and its phases and types, and so on. Wound definitions of wound: any break in the integrity of the skin or the tissue which may be associated with the disruptions of the structure or functions. It may be due to trauma, radiations, infections and iatrogenic etc. Classifications of the wound: on the basis of the Rank and Wakefield classification, it is tidy wound and untidy wound. Tidy wounds are surgical incisions, wounds by the sharp objects and keloids. Untidy wounds are the avulsion, cross injury and devitalized injury. On the basis of the types or morphology of the wounds, they are bruising and contusion or hematoma, clean incised wound, lacerated wound, abrasion, cross injury, penetrating wounds and perforating wounds, deglobing wounds, etc. And on the basis of surgical classification, they are clean wound, clean contaminated wound and dirty infected wound. Clean wounds, the infection rate is less than 2%. Clean wound is non-traumatic, uninfected operative wound in which neither the respiratory, alimentary or genitourinary tracts nor the oropharyngeal cavities are injured. Clean wounds are elective, primarily closed and the undrained wounds. Clean contaminated wound, the infection rate is less than 10%. Gastrointestinal, respiratory or genitourinary tract injured without significant spillage or wounds without which are mechanically drained. Examples are appendectomy, gallbladder, biliary, pancreatic surgeries, etc. Contaminated wound, its infection rate is 15 to 30%. An operative wound contaminated. Fresh traumatic wounds from the clean source. Gross spillage from the gastrointestinal tract. When infected urine or bile is present. Incision encountering acute non-purulent inflammations. Its examples are penetrating abdominal injury, enterectomy, etc. And lastly, dirty wounds. Its infection rate is 40 to 70%. Traumatic wounds from the dirty source, fecal contaminations, foreign body written devitalized tissue. Operative wounds, acute bacterial inflammations or perforated viscous. Presence of pus. Examples are abscesses, drainage and pyrocele. Wound healing. Let's discuss about the wound healing. Wound healing is the physiologic response to the tissue trauma. It is related to the tissue reconstitutions, which is process by which the body replenishes cells that are being lost. Types of wound healing are primary, secondary and the tertiary. Primary healing occurs in the clean incised wound, more epithelial regeneration than the fibrosis. Wound heals rapidly, scar will be linear, smooth and the supple. And secondary healing occurs in the wounds with extensive soft tissue loss, heals slowly with the fibrosis, wide hypertrophied and the contracted scar. And tertiary or delayed primary are initial wounds, debridement and the control of the local infections, wound closed with the sutures or covered with the skin grafts. And phases of the wound healing are inflammatory phase, fibroplasia phase or proliferative phase and remodeling phase. Inflammatory phase. Let's discuss about the inflammatory phase. It occurs, inflammatory phase is also called lag phase or substrate phase. It occurs in 0 to 48 hours. It has two response, vascular response or cellular response. Firstly, vascular response. It occurs in two phases, primary phase and secondary phase. Primary phase, hemostasis, vasoconstrictions, platelet aggregations and degranulations, fibrinous clot and fibrinolysis. And in secondary phase, venular vasodilation into 10 into increase in the blood flow, Increased vascular permeability adds to the flow of the chemical and the cellular mediators PDGF in the inflammatory to set site of injury. Lymphatic obstruction lead to the tissue edema. And cellular response increase vascular permeability during inflammation phase and facilitates marginations, exacerbations and migrations of the cellular mediators PMNs and macrophages. PMNs functions short-lived 0 to 48 hours, attack bacteria then leaves, not essential for wound healing process. And macrophages monocytes derived central cell during inflammatory phase of the wound repair, activated by the lymphokines immune complexes, release angiogenesis factor, phagocytase of the wound debris essential for wound healing. Factors affecting inflammatory phase are the pus, necrotic tissue, foreign body, hematoma and steroids. Pus contains both proteolytic and the collagenollytic enzymes, prolongs the inflammatory phase and retards epitheliogenesis. Necrotic tissue, foreign body and hematoma, prolongations of inflammatory phase. Steroids inhibits macrophage functions. And proliferative phase, aka fibroplasia phase, they are 2 to 6 weeks. Clinical signs are the disappearance of the inflammatory signs, reductions of the swelling, reductions of the wound size, contractions and itching. And key elements are the net collagen synthesis, increase in wound tensile strength and scar formations. It has 3 subdivisions: epithelializations, wound contractions and collagen deposition. Firstly, epithelializations is the requirement for the ordinary progressions into the proliferative phase. It starts in the inflammatory phase. It requires differentiations, mitosis, migrations and then re-differentiations by the basal cells of the epidermis. And wound contractions, wound heals from the side to side but contract from end to end. Thought to be mediated by the myofibroblast, can produce collagens but also contains smooth muscle filaments. Highest rate of the contractions from day 10 to 21 and begins approximately 4 to 5 days after wounding. Represents centripetal movements of the wound edge towards the center of the wound. Maximal contractions occurs 12 to 15 days, although it will continue longer if wound remains open. The wound is moved towards each other at an average rate of 0.6 to 0.75 mm per day. Wound contractions depends on the laxity of the tissue, so the buttocks wounds will contract faster than the wound on the scalp or the peritibial area. Wound shape also factor, square is faster than circular. And this is the figure. And another stage is collagen depositions. Prior to the collagen deposition, fibroblast deposits ground substances composed mainly of the glycosaminoglycans. Function of the ground substance is to create a scaffold onto which collagen can be deposited, aggregated and orientated in appropriate fashions. Starting at the 3 or 4 collagen is deposited, net collagen deposition is positive until day 21. It reaches a maximum at 60 days post injury, 80% of the tensile strength of the normal skin. And maturations and the remodeling phase. Maturation and remodeling phase, it lasts for 3 weeks to 1 to 2 years. Type 3 collagen is replaced by the type 1 collagen. Creations of the more stable bonds between the fibers decreases the amount of the collagen required to maintain wound integrity. Durations of the phase dependent upon the patient's age. Decrease age, increase duration. Racial differences, type of the wound, body locations and durations of the inflammatory phase. And these are the graphs of normal healing, delayed healing and impaired healing, chronic wound mechanical strength with time. Incised wound. Incised wound is caused by the sharp cutting instruments. Minimum loss to the tissue tends to gap. The extent of the gapping depends upon the elasticity and the tension. Edges are regular, bleeds freely and painful. Heals by primary intention healing. Lacerated wounds caused by the tearing of the tissue. Wounds have irregular lacked borders. Loss of the tissue is limited to the skin and the tissue. Deglobing avulsions injury occurs when the skin and subcutaneous tissue are stripped from the underlying fascia, leaving a neurovascular structure, tendons, or bone exposed. Here is the question: what is the type of the wound according to the rank and Workforce classifications? It is untidy wounds. Factors affecting wound healings are the local and systemic. Local factors are infections and hematoma, presence of the necrotic tissue and the foreign body, poor body blood supply, venous and lymph stasis, tissue tensions, large defect of or poor appositions, and history of the irradiations, underlying disease like malignancy, osteomyelitis, tissue hypoxia. And general or systemic factors are age, obesity, smoking, malnutrition, vitamin deficiency, anemia, uremia, jaundice, diabetic, steroids, and cytotoxic drugs. Managing acute wounds by hemostasis, cleansing, explorations and diagnosis, debridement, repair or structure, replacement of the lost tissue, skin covers if required, skin closure without tension, all the above with careful tissue handling. When does the wound become chronic? In healthy individuals with no underlying factors, an acute wound should heal within 3 weeks, with remodeling occurring over the next year or so. If wound does not follow the normal trajectory, it may become stuck on one of the stages and wound become chronic. Chronic wounds are thus defined as the wounds which have failed to proceed through an ordinary and timely process to produce anatomic and functional integrity without establishing a sustained anatomic and functional result. Thank you very much for watching this video. Don't forget to like, share and subscribe my channel. Thank you.